Hello, welcome. In this video, let us actually look at chloroquine. We've been escaping this chloroquine from so many videos, right? Chloroquine is also called as CQ. Chloroquine. What is it? It is a 4-aminoquinolone. Okay, 4-aminoquinolone. If you remember, here we have seen in the classification here, 4-aminoquinolone is chloroquine. Okay. So basically, where and all do you use it? We have written that here. It is called as CQ. It is used for clinical cure of malaria. It can also be given for prophylactic treatment and Vivax. It is mainly effective against Vivax and sensitive Plasmodium falciparum. It can also be used against Plasmodium ovale, Plasmodium malariae, those type of Plasmodium also you can use. Then what else? That's all. So far we have seen that much. Chloroquine is going to have effect against the erythrocytic phase of the Plasmodium. It is having rapid onset, long duration of action, which is very, very good. It will not prevent relapse because it has no effect against hypnozoids. It does not have effect against gametes. It does not have effect against pre-erythrocytic forms of Plasmodium. And one good thing is the resistance development in Vivax is slow to chloroquine. However, most Plasmodium falciparum have developed resistance. It is toxic but not very, very toxic compared to the others. So 4-aminoquinolone, example is chloroquine. It is rapid acting, long acting, slow resistance development in Vivax. It is against the erythrocytic phase and it is a erythrocytic schizontoside. It is going to kill the Plasmodium. Erythrocytic schizontoside, mainly against Plasmodium vivax, ovale, malariae, and against chloroquine sensitive falciparum and knowlesi. Okay. Mainly vivax, ovale and malaria you should remember. There is no action against pre-erythrocytic forms or hypnozoids or gametes. And it does not prevent the relapse. That's also another negative point for it. Now let us go to mechanism of action. Mechanism of action, it is how exactly chloroquine acts. Now a person has malaria, now you have given chloroquine. Now what exactly this chloroquine will do? First of all, these Plasmodia are there. No, what they will do, they will pick up the chloroquine. Through this food vacuole, they will pick up the chloroquine. Wait. So you can see here, this is a schizont which will pick up the chloroquine through a food vacuole. It will pick up. Now what happens? Because hemoglobin is there in the RBC. Now it will bind to heme. And a drug heme complex is formed which is toxic. This drug heme complex which is toxic is going to damage this membrane of this parasite, Plasmodia, and the parasite gets killed. So first of all, the damage is to the membrane because of this drug heme complex. That is the chloroquine heme complex. Then coming to some more details here. There is inhibition of conversion from heme to hemozoin. Actually, what this Plasmodia does, they go into the RBC, they feed on this hemoglobin. What do they eat, guys? What do the Plasmodia eat? They eat the hemoglobin. They get nutrition from hemoglobin. And they convert this heme into hemozoin. Now what will happen? The conversion of this heme to hemozoin will be inhibited. They will stop the degradation of hemoglobin, you can say. Okay, it is a weak base. What is a weak base? Chloroquine is a weak base. So it will get concentrated inside the vacuole of this Plasmodia. Plasmodia derive nutrition by digesting hemoglobin. So now what will happen? There is nobody to digest the hemoglobin. Hemoglobin degradation can be stopped. Shall we move on, guys? Pharmacokinetics of chloroquine. Chloroquine is actually, you can give orally, even parenterally it is available. Nothing different here. Metabolized in liver, metabolites excreted in urine, same story only, nothing different. The only special thing here is it needs loading dose. So the first dose that you give will be usually double the concentration, 600 mg it will be. Then again subsequently you will get 300 mg. Now why does it need loading dose? Can you explain that? Yes. Chloroquine when taken, initially it will go and settle into all the tissues, okay? Especially the melanin containing tissues, it will bind to these tissues. And not only that, it will persist in these tissues for months. So that is another thing if you want you can remember. But basically you need a loading dose. The first dose usually will be higher. What requires loading dose? Tell me, friend.
Chloroquine requires loading dose. Chloroquine anti-malarial drug requires loading dose.
Let's move on, guys. So far we have looked at pharmacokinetics. Now let us look at the adverse effects of chloroquine. Usually it is not so bad. It is having low toxicity only. And adverse effects are actually nausea, vomiting, anorexia, uncontrollable itching, epigastric pain, uneasiness, difficulty in accommodation and headache. So very, very normal type of side effects only, but they are quite unpleasant. That's what their problem is. So problem is like headache, difficulty in accommodation, uneasiness, all these. Nausea, vomiting, anorexia, hypersensitivity, headache. These are standard things that you will write for everything. Chloroquine, no different. Just write all that, okay? Itching and all, again, hypersensitivity only you can write. Contraindications of chloroquine. Don't give in liver damage. Why? Because it is metabolized in liver only. Can be given in pregnancy. This is the only different thing. Chloroquine can be given in pregnancy. This is not a contraindication. This is an ulta of contraindication. You can give in pregnancy. So let us tell that also now.
Chloroquine, anti-malarial drug, can be given in pregnancy.
Okay, let's move on. Uses of chloroquine. See, we have seen uses. Prophylaxis you can give. Then you can give for vivax, malaria. Then you can give for chloroquine sensitive Plasmodium falciparum malaria. Then you can give to pregnant women to treat malaria. Okay. Chloroquine is active against Entamoeba histolytica and Giardia lamblia as well. Chloroquine is active against Entamoeba histolytica and Giardia lamblia as well. This is the anti-amoebic drug. Look at this. In this you remember you have seen chloroquine. It is effective against amoeba, Entamoeba histolytica, Giardia lamblia, etc. So let's go back now to the malaria, anti-malaria. So these are the uses of chloroquine. Okay, chloroquine uses. You can as well use it against Entamoeba histolytica, Giardia lamblia. Now vivax, Plasmodium vivax caused malaria. And you can write Plasmodium ovale, Plasmodium malariae, Against all these you can use actually. We'll meet in the next video, guys. We have covered everything we wanted about chloroquine, the uses, contraindications, adverse effects, pharmacokinetics, mechanism of action. Everything we have covered. So let's meet in the next video. Just pay attention here to the dose, okay? Chloroquine 600 mg, that is loading dose, followed by 300 mg after 8 hours and then for 2 days with primaquine to prevent relapse. Okay, chloroquine, same thing for sensitive falciparum, same thing. So this you should know, this regimen you should know, okay? Bye.